your body's natural response to stress. It's normal to feel anxious about moving to a new place, starting a new job, or taking a test. Ordinary anxiety is a feeling that comes and goes, but does not interfere with your everyday life. In the case of an anxiety disorder, the feeling of fear may be with you all the time. This type of anxiety may cause you to stop doing things you enjoy. Anxiety disorders are the most common form of emotional disorder and can affect anyone at any age. A person with panic disorder may live in fear of the next panic attack. Phobia, excessive fear of a specific object, situation, or activity. Social anxiety disorder, extreme fear of being judged by others in social situations. Obsessive compulsive disorder, recurring irrational thoughts that lead you to perform specific, repeated behaviors. Separation anxiety disorder, fear of being away from home or loved ones. Illness anxiety disorder, anxiety about your health, formerly called hypochondria. Post-traumatic stress disorder, PTSD, anxiety following a traumatic event. Anxiety feels different depending on the person experiencing it. Feelings can range from butterflies in your stomach to a racing heart. Other ways people experience anxiety include nightmares, panic attacks, and painful thoughts or memories that you can't control. Symptoms of general anxiety include increased heart rate, rapid breathing, restlessness, trouble concentrating, difficulty falling asleep. Your anxiety symptoms might be totally different from someone else's. That's why it's important to know all the ways anxiety can present itself. Read about the many types of anxiety symptoms you might experience. An anxiety attack is a feeling of overwhelming apprehension, worry, distress, or fear. For many people, an anxiety attack builds slowly. Anxiety attacks can vary greatly, and symptoms may differ among individuals. Common symptoms of an anxiety attack include feeling faint or dizzy, shortness of breath. A panic attack and an anxiety attack share some common symptoms, but they're not the same. Researchers are not sure of the exact cause of anxiety. Current research of anxiety is taking a deeper look at the parts of the brain that are involved with anxiety. A single test can't diagnose anxiety. Some doctors may conduct a physical exam, including blood or urine tests to rule out underlying medical conditions that could contribute to symptoms you're experiencing. Several anxiety tests and scales are also used to help your doctor assess the level of anxiety you're experiencing. Once you've been diagnosed with anxiety, you can explore treatment options with your doctor. In moderate or severe cases, however, treatment can help you overcome the symptoms and lead a more manageable day-to-day life. Treatment for anxiety falls into two categories: psychotherapy and medication. The Healthline Find Care tool can provide options in your area if you need help finding a mental health specialist. Medications typically used to treat anxiety include antidepressants and sedatives. They work to balance brain chemistry, prevent episodes of anxiety, and ward off the most severe symptoms of the disorder. Lifestyle changes can be an effective way to relieve some of the stress and anxiety you may cope with every day. If these lifestyle changes seem like a positive way to help you eliminate some anxiety, read about how each one works, plus, get more great ideas for treating anxiety. If you have an anxiety disorder, you may also be depressed. Anxiety can be a symptom of clinical or major depression. Symptoms of both conditions can be managed with many of the same treatments: psychotherapy, counseling, medications, and lifestyle changes. Anxiety in children is natural and common. In fact, 1 in 8 children will experience anxiety. But, anxiety in children can also become chronic and persistent, developing into an anxiety disorder. Symptoms of an anxiety disorder might include jitteriness, irritability, sleeplessness. Learn more about the signs of an anxiety disorder as well as techniques to help calm your child's anxiety. Teenagers may have many reasons to be anxious. Tests, college visits, and first dates all pop up in these important years. Symptoms of anxiety in teenagers may include nervousness, shyness, isolationist behaviors, and avoidance. For some teens, depression may accompany anxiety. The most common treatments for anxiety in teenagers are talk therapy and medication. Stress is the result of demands on your brain or body. Anxiety can be a reaction to your stress, but it can also occur in people who have no obvious stressors. Neither stress nor anxiety is always bad. Both can actually provide you with a bit of a boost or incentive to accomplish the task or challenge before you. The long-term outlook for untreated depression and anxiety includes chronic health issues, such as heart disease. If you're anxious frequently, you may decide you'd like a drink to calm your nerves. It can depress the activity of your central nervous system, which may help you feel more relaxed. In a social setting, that may feel like just the answer you need to let down your guard. Chronic or long-term use can ultimately make the condition worse, too. Anxiety disorders can be treated with medication, psychotherapy, or a combination of the two.